I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Today we're here in the library at Downstate Medical Center, a place where they have trained many physicians, nurses, and all the other occupations in health right here at Downstate. Today we're going to do a little differently than we did generally in the studio, because I ran into a friend of mine that went to medical school here, and she's just finished her residency and she's going for a fellowship and things like this, but we'll get into that. But the main thing I want to bring out today is that about sickle cell anemia. For many, many years, I treated folks or young people with sickle cell anemia, from babies right until adults. And you know, most of the time they think that's a debilitating disease because of the pains and the crisis that they go through. And they go through a lot of pain, and they go through a lot of crisis and things like this. But to find someone who went to medical school, even though they went through crisis, had to take the same exams, nobody patted them on the back and said, we'll give you a special time off and things like this. I met her coming down the hall today at Downstate Medical Center because she just finished her residency in medicine. So I want to get you to introduce you to her, and we're going to get the story of what happened to Titania Brown here at Downstate Medical Center. Hi, Titania. It was so nice having you here. And I saw you coming down the hall looking all pretty and everything. And I said, let's do a show today to catch you on time, because I just wanted you to give a little background of who you are, where you grew up at, and things like this, and how you actually thought you were going to be a doctor.
Okay, no problem. So I was born in California. My parents are West Indian from Trinidad, and my father was in the Marines. So when I was born on Camp Pendleton, and at that time, 1978, they were not doing newborn screening.
Right.
So about 6 months into me existing, I started crying all the time. And my parents took me to the base hospital, and they kept taking me back and forth. My hands were swelling, my feet were swelling. They didn't understand what this was caused by, and they saw my blood under the microscope, and they saw that my cells were sickled. And at that point, they figured out that it was sickle cell anemia.
That's very
But the doctor on the base did not know much about sickle cell, and my parents definitely didn't know anything about sickle cell. So the doctor was reading about it at night in the books and was telling my parents about it in the daytime. And so my parents started learning about what is this disease, and that it's genetic, and it was, you know, due to their genes that I had this disease. And they then raised me and taught me about the disease from jump.
I see.
So I've always known that I was a little bit different from all my peers.
Right.
I always would be in and out of the hospital, lots of painful episodes. When I was younger, I had quite a bit of infections, because that's also a factor of sickle cell anemia. But they learned in the 80s to put the children on antibiotics constantly. So I stayed on antibiotics until my teen years. And
Every day?
Every day.
Every day on the
I had to take,
antibiotics, just to keep down infection?
To keep down the infection.
Right.
So every day I had to take it, and I wasn't happy, but that was the first set of pills that I would take every day.
Right.
I also had to learn how to take folic acid every day.
Right.
But
When you speak of folic acid, maybe explain a little bit about folic acid.
it's a vitamin.
Vitamin, sure.
But it works by helping the red blood cells.
That's right, surely.
So,
to exist longer.
Exactly.
Right,
And so since sickle cell anemia has, it's a genetic disorder of the red blood cells, that you're deficient because the cells are formed differently.
Surely.
They're sickled because of a mutation in the genes, that you need hydroxyurea vitamin specifically to help build up your cells.
Now, when you say even sickle, so the audience can get an idea, what does that cell look like? A red blood cell, is this a round cell, isn't it?
It is. So what I like to tell people is, your cells look like donuts.
Donuts, okay.
And my cells look like bananas.
There you are. That's a good sign. That's right.
When your cells rotate through go through the body, go around the body, the donut rolls, and so it's easy for a donut to roll around through the body.
Surely.
And the donut has a little hole in the middle where it carries the oxygen.
Right, surely.
And it carries that oxygen all throughout the body.
That's a good idea.
The banana, however, doesn't have a hole, and it has these kind of pointy edges.
Right, yes.
So it doesn't roll so well,
Right.
and it doesn't carry as much oxygen because it doesn't have that nice round hole.
Right, sure.
So I become anemic, which means I don't have a lot of oxygen to go around my body,
Right.
and I can get painful crises.
Right.
They don't have an exact cause of it, but the assumption is, or the general idea is that these bananas, they get stuck. The edges get stuck,
Right.
and they block everything else up, and so
Like
then
logs blocking
like logs blocking
a flow of water.
Yes,
Yeah,
exactly.
surely.
I mean, this is just an easy way of explaining
course,
it. I mean,
of
it's not
course.
exactly this way, but just to understand.
Right.
And so since it blocks it up, you get pain.
Pain,
And now
sure.
this can happen anywhere in the body.
Surely.
These blocked cells can happen in the brain, and
The
can happen
eyes.
in the heart, it can happen in the lungs, can happen in the kidneys,
Oh,
can
yeah.
happen in the vessels near the skin.
Surely.
And because it can happen anywhere, you can therefore have lots of problems with that.
Right,
So
sure.
sickle patients can have strokes, they can have heart problems, they
Sure.
can have lung problems, kidney problems,
Eye problems. Sure,
they can
sure.
lose vision, they can have kidneys, like I was saying,
yes.
liver problems, they can
Sure.
have blockage in a thing called gallbladder.
Yeah, surely.
And they can get stones,
Yeah.
and that's mainly because the cells are breaking down so much
Mm-hmm.
that they build up a bilirubin,
Right, surely.
and they get bilirubin
Stones, that's right, surely.
And so all these are factors
Oh, yeah.
that sickle patients can get,
Sure.
in addition to getting prone to infections, in addition to having painful episodes.
Mm-hmm.
So it's just a multi-organ disease
Right.
that
right.
affects African Americans, blacks. I shouldn't just say African American. So any blacks, Mediterraneans,
Sure, right down to Egypt.
Egypt.
Sure.
There's parts of India as well
Oh,
that
India
can,
also,
that can
yeah.
affect have
And certainly in
sickle cell.
Africa.
Definitely Africa.
Sure.
So it's a genetic disorder, and that's what
Right.
we're working on how to. Not we, but there are people working on how
Right.
to fix it and deal with it.
Now tell me this, you having these crises and having such pain and things like this, your parents had to take such good care of you.
They definitely
And I
did.
know it was such a chore, chore to do this. How did you make out in grammar school and high school and then go to college? Maybe get into that.
They were very big on education. Being first generation Trinidadian American, my parents were very much big on education. No matter if I was sick in the hospital, they were bringing my books. The teachers were sending my schoolwork to the hospital. My friends were bringing my schoolwork back to school with
Yes,
them so I
right.
could carry my information back.
Sure. Taking tests?
Taking tests in the hospital.
They didn't give you any
No,
special attention
no,
there?
I had to still take my tests. I still had to do my homework. I still had to read my books
Isn't that something?
while being in the hospital, away from my classmates.
Yeah.
My parents were by my side. They had to learn it they already knew it. They graduated from college.
Right.
And so since they graduated from college, they wanted me to as well. So they would teach me when I was in the hospital, or if they didn't have time to teach me, they got a tutor to help me learn.
What
in
about
school.
sisters and brothers?
So I have one brother. We're 8 years apart because my parents didn't want to have any more children
Children,
once
that's
they
right.
learned that
Oh.
it was a genetic disorder. But I'm happy we have my brother.
Oh, that's nice. Does he have sickle cell anemia?
He does.
I see.
We both have the disease,
I see.
sickle cell anemia. So hemoglobin SS is what we
Right.
have. And he unfortunately had the condition of strokes when
I
he
see.
was 4 years old.
Oh, I see, yes.
Because of the sickle cell.
Right.
And that, because of the strokes, he lost his speech and his motor abilities. So he can't walk or talk, and
Oh,
he's
I
in a
see.
wheelchair.
Oh, I see.
His brain is intact, but his body is
Are
not.
your parents still living?
My father is alive.
I see.
My mother passed away a year and a half ago
Oh, I see. Okay.
from breast cancer.
I see. All
So-
right.
But up until, and currently, my father still takes care of my brother, and I help take care of him.
Oh, that's wonderful.
And it was actually because of him I went into medical school, and I
Wow.
chose medicine, period.
What high school did you go to?
I went to Hillcrest High School.
Hillcrest High School.
In Queens, yes.
Right. And then in high school, did you have any idea you want to be a doctor then?
I did, but the reason why I thought I wanted to be a doctor was because of my brother.
Right, yeah.
My brother got sick when he was 4, I was 12.
Yes, right.
And so I was in junior high,
Right.
and I watched the doctors work on him and and in my 12-year-old mind, bring him back to life.
Yeah.
And I thought that was the coolest thing in the world.
Oh, yeah.
And I wanted to do that. So I went into high school knowing that that's what I wanted to do, but not because high school taught me that, but because my brother taught me that.
Yes, isn't that interesting?
And so, yeah, I did know that I wanted
In other words,
medicine.
you're caring for a person who had a chronic disease, which we'll get to in a moment, about taking care of people with the chronic conditions, medical conditions. Now, you had to have a magnificent mother and father to do all that what
They're
they
pretty
did.
amazing.
Yeah. And I know you must have had a lot of hospitalizations during that time,
Yeah.
right? What hospitals did you usually get
Brookdale
hospitals?
Hospital.
Brookdale Hospital.
So my parents, when they moved from California to New York, they were told that at that time in the 80s that the comprehensive sickle cell program that was near Queens was in Brooklyn
I see.
at Brookdale Hospital. The other comprehensive one was at Kings County
Kings County,
Hospital, but Brookdale's closer to Queens, just
Right.
geographically.
Yeah, right.
So it was just easier for them to drive up Linden and hit Brookdale first,
Right,
instead
yes.
of keep on driving to hit
Yes,
Kings
right.
County. But that's how come I ended up at Brookdale, because
Yeah.
that was what they learned.
So now you went to Hillcrest High School, you graduated. Did you find a course? How did you do in your courses generally? Because being sick and going in hospitals and things like this, how did you do?
Thankfully, with the support of my parents and friends and tutors, I pretty much got A's and B's.
A's and B's.
Yeah, my family was very big on school. Like I said,
Right.
I was getting trained, day and night, in the hospital, out the hospital, didn't matter.
Right.
I had to learn my lessons.
Yes.
And so it was mandatory to get good grades in my house. And if I wanted to get any prizes, or if I wanted a bike or a television or anything like that, I had to produce good grades.
Oh, that's wonderful.
So-
And now, as far as college is concerned, what college did you choose, and why did you choose that particular college?
I went to New York University.
Okay, NYU.
Yeah, so I've been
Oh,
a New Yorker. I
wow.
came here and stayed here.
Oh, that's great. That's great. And
Um,
your major was?
was psychology.
Okay.
I learned about psychology in my first year of college. Just happened to take a course. I didn't know what
Right.
it was
Sure.
about, honestly. And advisor told me, try a psychology class. And when I took it, I was like, this is so cool. It teaches you about how people think and
Yeah,
where they
right.
come from. And,
Oh, yeah.
and I was very intrigued with that.
All right.
And I found out that I can be a psychology major and still be pre-med minor.
Oh, okay.
So that's what I did for college.
And I mean, I used to go down to NYU on Saturdays and speak to the college students and so forth,
And I learned about NYU by going to a Saturday class when I was in high school.
Right, yes.
Because my
right.
parents got me into the STEP they learned about a program called the STEP,
STEP program, yes.
Geared towards minority students
Sure.
in high school to help expose them to colleges.
That's right.
And give them additional tutoring and training on
Right.
Saturdays.
That's right.
So for my sophomore, junior, and senior year, so 3 years of high school, I went every Saturday to NYU.
I remember.
So when I learned about the college, I said, well, this is where I'll be going for college. And I got accepted.
I know, and I know it was a rigorous course there at
It
NYU.
definitely was.
It wasn't hard.
definitely was.
Just some of the courses that you took in college. From biology to chemistry.
All of them. So I
Organic.
was pre-med, so I had to do organic chemistry 1 and 2, biology. I did AP Bio in high school, so I opted out of the first half of bio,
sure.
but I had to do the second half of biology.
All right.
I had to do physics 1 and 2.
Physics,
I
yeah.
had to do
Organic chemistry.
Thank you.
Inorganic chemistry.
inorganic chemistry.
Oh yeah.
All of the sciences.
It was hard.
Yes, it definitely was.
I don't know how you did it.
I
Now,
know.
during that time, were you experiencing any hospitalizations due to crisis while you were going to school?
So my college years was extended by an additional few months.
Right.
Because I was hospitalized for a month and a half.
Right.
I had a really bad infection.
Right.
And then they found that I had gallstones.
Okay.
The stones were blocking and causing me
Right.
to become septic, which is
Sure.
infection throughout the whole body.
Body, yes.
And I was in I was in ICU actually.
Right. Sure.
and with multiple complications from the sepsis.
Sure.
So I missed the whole fall semester of my senior year.
Wow.
But I was so determined to graduate with my class
Right.
that I took my fall and spring courses
I see.
in the springtime
Right.
at the same time.
Oh,
So I
boy.
had a
Double
load
Wow.
in the second half of my senior year,
Boy.
just coming off of this month and a half long illness.
Illness, yeah.
And I was determined to graduate with my class, and I did.
Well, now,
I graduated in August instead of June,
Right,
so it
now-
was just 2 months off.
now getting into Downstate Medical College at that time, it was rigorous, it was competitive and so forth, and here you are, say, a young African American from the islands. How did you get into medical school? Now, this was high competition to get in here.
It was. The first time I applied to medical school, I did not get into medical school
sure.
because although my major grades in psychology was
Sure.
really good,
Sure.
my science grades were not as good.
Right, sure.
And it was mainly because I just was sick so much. I missed a lot of classes,
Sure.
and you have to take laboratory work.
Right, sure.
And I missed a lot of lab work in being in
Right.
the hospital during college.
Right.
And NYU was not trying to give me breaks. They said I had to complete all the courses.
I know they didn't give you any breaks, and it was expensive.
And it was quite expensive.
Quite
I'm
expensive,
still
yeah,
going
sure.
to pay for that for some time.
Sure.
So I had to do a post-bac class,
I
a
see.
post-bac program.
Sure.
And Downstate actually works with a post-bac program and says if you pass in this particular post-bac program and do really well in it, keep a 4.0 GPA, pass the MCATs, do really well in the MCATs, you can be on the list to be accepted into
Wow.
Downstate.
Well,
So I took
was
that
a-
opportunity.
That was a jump. That was one jump
I
for
took
you.
that opportunity.
Yeah, that's
and
wonderful.
I went up to SUNY Buffalo, upstate in
You're
Buffalo,
right.
and I spent one hard year studying all the sciences.
Wow.
I got a 4.0 GPA.
Oh, and when you say 4 point, that's the highest you can get, right?
That is no 3 point.
3 point, yes, right.
I got 3 points is good, but 4 points is the highest.
Right, yes.
And I was determined to get the 4.
Now, going to college now, and you got out of college, now you're going to enter medical school. 4 years of medical school had to be difficult with in and out of the hospital with your crisis and so
Yes.
forth. Yes.
Well, Downstate, they took a chance on me. I did not hide that I had sickle cell.
Okay, right.
In my personal statement, I told them that I have sickle cell anemia.
Right.
And to get into medical school, you have to tell them about yourself and tell them why you want to become a doctor.
All right.
That's part of the application process, as you
Sure.
know. And I told them from jump, this is what I have, this is why I went into medicine, this is what I'm interested in, and I want to be a doctor. So they took a chance on me. They knew that I would get sick, and I've gotten sick multiple times in the past.
yeah.
My college year was extended a bit.
Sure.
I had to take some extra time for post-bac.
Gosh.
But they worked with me.
Isn't that
And
wonderful?
when I first got sick as a student, they were a bit concerned. They didn't know if maybe I could handle the workload of being
Right,
a medical student
sure.
and my illness. But I was determined, and I wanted to let them know that I could do this with the disease. The disease wasn't going away. It's chronic.
Right.
So I'm going to have to work with the disease and still finish school.
Wow.
And I did. And because they saw that I was so determined and that drive in me,
Sure.
I really had a lot of support. And the deans really
your-
came
and your
together.
friends, your student
my
friends, yes.
my classmates are invaluable to me.
I know.
I mean, I truly could not have made it through medical school without my classmates.
This is quite a story.
So
quite
it
a
was.
story. Boy.
I actually remember very distinctly being sick in November, and I was hospitalized at Kings County, and we were doing the skull. We were learning about the bones and the nerves and everything of the skull. And my classmates brought over the bone box. We called it the bone box. And there's just different bones in the box.
Right.
And you have to know all the different bumps and holes and what nerve goes through this hole
Sure.
and what muscle is attached, what tendon is attached.
Kinesiology.
And they brought the box to my hospital bed room, and I'm hooked up to all of the
IVs and things.
IVs and
Yes.
we're going through the bone box and learning about the foramens and the ovales, everything about the skull. And I'm in my hospital bed.
and nobody gave you any special marks for anything. You had to compete with everybody who
had to compete.
Just had a normal existence in a sense. And so when I say normal, certainly didn't have a chronic condition to hospitalize them.
Right.
And I used to see you in medical school, and I used to admire you because you'd be walking with your friends, and you might be limping a little bit, and things like that, you know. And but you still had that determined face that this story should be told all over the world, especially to young people who have any kind of disability, because what you went through, it wasn't just a disability of a blood condition, it affected the whole body at that time, and pain and things like this.
Muscular pain.
Muscular pains.
Joint pain. So it wasn't just a blood disorder, you're right.
That's right.
And so...
And all of a sudden, you go through 4 years of medical school, you got decent marks and everything, and everybody liked you, and the teachers liked you, and your fortitude and your determination, and all of a sudden you had your gown on, crossing the stage, because I was sitting there looking at you when you crossed that stage. I said, there she goes again. There's Tanya Brown doing her thing right across that stage. And I guess your father was in the audience, wasn't he?
He was.
And I know he was proud.
Yes, he was. Both my parents were in the audience. They were proud.
Yes. Was your mother living at that time?
Yeah, she just passed when I was in residency.
All right.
Yeah.
Well, so now, all of a sudden, now you're in a residency at Kings County Hospital. And residency is another 4 years.
3 years.
3 years.
Yeah.
And what was that 3 years like? Did you get sick during that time when you were studying medicine?
Did, actually. I got quite ill. It was interesting because I remember getting sick I was admitting patients and ended up becoming a patient by the end of the day.
Isn't that something?
But my team that I was working with did not admit me. They had the other team admit me. Because it would have been a little too weird.
But you were really ill at that time, though.
Yeah.
Probably low blood count.
My cells were low.
Probably
I needed a blood transfusion.
And the pains.
I had pain. I was getting antibiotics.
Just tell about the number of blood transfusions you had during your time.
I've had way too many to count.
Too many to count, sure. But
I
here,
had way too many to count.
I just want to make that plain, because here you're sitting here like you're a total, completely healthy individual, which you are now, in a sense. But it must have been a rigorous thing to examine patients, write their histories, do all the things you had to do as a patient, being a patient yourself.
Being a patient. Actually, it kind of gave me a unique perspective, where some of my peers would just become frustrated when they saw a patient put their wallop of anger, of back away, leave me alone, I don't want to be bothered. And they get frustrated. They say, why did you even come to the hospital? Why did,
They would say that
angry.
to the patient?
No, they'll say it among themselves.
Sure.
They'll say, well, why did this patient come to the hospital? They don't even want to be treated.
Yeah, you're right.
They don't want my care, and here I am trying to help them.
Sure.
And I had to explain to them, being a patient is a scary thing.
It is.
You're scared, you're vulnerable, you're exposed as weak. No one ever wants to show that they're weak. Everybody always wants to show that they're strong and they can handle anything. And so when you're in that position of weak and needing help, it's easier to throw up the mask and the defense mechanism of anger. It's easier to say, back away, I'm fine, than to say, I really need your help because I'm broken. And it's not about sickle cell or it's about
terminal cancer or any of these
any
diseases.
Any disease, even diabetes, high blood pressure, cholesterol, anything. And the patient, you needing help from another person, and you realizing that you are not healthy or strong or perfect, can make a person feel a certain way, insecure or scared or nervous. People always worry about their mortality. And they don't want to say that I'm scared about my mortality. They just want to say, leave me alone, I'm angry, I'm strong. But in reality, they're saying, I'm scared. I'm worried if I'm going to die.
And that's really interesting, because you being in that situation yourself all those years, being a doctor now, which it took 4 years of medicine, where you had 4.5 years, and doing all the testing and things you had to do to get your boards and things like this. And all of a sudden now, you're making a choice of a lifetime choice. What are you going to do in life? And you told me that before we came on the scene here, you wanted to be one thing, but you turned to be something else.
Yes. So I came into medical school and medicine to be a hematology oncologist.
That's what you were aiming at. Hematology, which is a blood disorder.
I was going to be the patient with the sickle cell blood disorder and take care of patients with blood and cancer disorders.
Right.
During residency, however, while I interacted with these patients, I realized that I lived with it too, and it was just a little too close for comfort.
Right.
My mother having cancer, my brother having a blood disorder, myself having a blood disorder, and then taking care of patients with blood and cancer was a bit too close to home.
I know.
That I just decided, I don't think I can do this. I don't know if I'd be able to give the patients what they need of me.
Sure.
But while I was rotating through hematology oncology, I did learn of the field called palliative care.
Palliative care, yes.
And this field takes care of, in my mind, takes care of the patient in a holistic way. They look at them and take care of their medical aspects as well as their pain, as well as their emotions, in a time where they're very vulnerable, where they're very weak, and they're close to terminal ending life. And a lot of medicine says, oh, I don't want to deal with that. I can't, I don't know how to deal with that, and just drop the ball. Whereas palliative care will come in and continue that journey.
Well, Tanya, you're going to be a palliative care doctor taking those people who really need your kind of care. And so it's just wonderful having you here today and to give your story.
Thank you.
And we'll look forward to you taking care of sick people and making them feel like they're going to live forever. Thank you so much.
All right.
You're right. Wonderful.
Thank you.
So you folks out there, I hope you learned about Tanya Brown today and palliative care. Here she is, all the way from a little baby right with sickle cell anemia all through the crisis and things it took and everything like this. And here she's going to be taking care of you later on in life.